Workplaces in Massachusetts are at the earliest phase of reopening. So far, Governor Baker has been criticized for proceeding with too much caution, but also for leaving many workers exposed to health risks. That second view is held by the Massachusetts Coalition for Occupational Safety and Health, or MassCOSH. To tell us about its report card on the governor's plan for reopening is the coalition's executive director, Jodi Sugerman-Brozan. Thank you very much for being with us, Jodi.
Thanks for having me.
So when I go to the state website, I do see things that the employers are supposed to do to make sure their workplaces are healthy and safe, but what's missing from the governor's plan?
Yeah, a few different things that we're very concerned. First off, a phased approach we think is great, but the health and safety protections that it's calling for just are not adequate. We know that workplace is a key way in which this virus is being spread to workers, their families, and communities. So we need to get this right to ensure that the workers are safe and that we can prevent the spread of the virus. So first and foremost, it relies on social distancing, hygiene, and cleaning and disinfection. All very important, but not the only ways to protect workers. And in fact, we highly encourage that every workplace goes through a hazard assessment, incorporating workers' voices into the process to identify the different ways that they could potentially be exposed to the virus, and then creating a plan for how to keep workers safe. The plan also calls for proper PPE or for workers wearing masks, but it doesn't talk about how different PPE will be identified. And it also requires workers to wear masks without saying that employers have to provide these masks. But by far, what has got us most concerned is the real lack of enforcement procedures that are identified in the plan. Because workplace standards are important, but they're only as effective as the enforcement of those standards. Right now, if workers see something or are concerned, there's no place in the entire documentation that has been put up on the website with a number to call. The enforcement has been put on the local boards of health and the Department of Labor Standards without providing any additional resources to those agencies. And there's no clear one place for workers to complain. And enforcement relies on workers to complain in order to get enforcement without supporting that effort and without protecting them from retaliation. Fortunately, the Attorney General Maura Healey's Fair Labor Division has stepped up. They do have a form and a number that they put up to be able to take complaints from workers. And different cities and towns are taking different steps on how to do this, but it is really the lack of enforcement that has been most concerning to us. The other piece that is really missing, which caused us to give failing grades, is that the data collection that we are doing on COVID-19 cases is missing one major glaring omission, and that is collecting data on occupation, industry, and employers. And the reason that is important is because we know the virus is being spread by workplace, and we want to be able to identify which work groups and which industries are being most affected so we can increase the protections, and also want to be able to identify where there are workplace outbreaks so we can intervene immediately.
For every workplace outbreak, there's an employer who said they're bringing it in from somewhere else.
Say that one more time. We're bringing in...
For every workplace outbreak or hotspot, there's an employer saying that, no, don't blame me. It's the workers where they're coming from.
Oh, it's a huge issue. And in fact, I spent the whole morning on a Boston City Council hearing for what's called Occupational Presumption, because our essential workers who have been working and, protecting us, taking care of our elderly, caring for the sick, driving our buses, they've been doing this over the past few months. And now employers are saying, no, they're not, those folks who are getting sick, they're getting it from community exposure, not workplace exposure. And that's making impossible for them to get the workers' compensation benefits that they deserve. So I testified this morning with many other labor leaders on the need for occupational presumption. If you're an essential worker who worked outside the home and you contract COVID-19, it should be assumed that you got that from workplace exposure so that you can get the workers' compensation benefits you need. Or in the tragic case that a worker dies, their family can get those benefits.
Now, all blame shifting aside, it seems that getting that workplace data is important for all of us, isn't it?
Totally. It's really a critical piece because it is not only going to protect workers, but protect the community, because the work is a key way that this disease is being spread. So we need to be able to collect this information to better identify which work groups are being most affected, protect those work groups, and identify important pathways of transmission.
Of course, another issue you're concerned about are the workers who don't want to go to the workplace, either because of their own health concerns or because they live with somebody who might be at a higher level of risk. What should be in place for them that isn't in place right now?
Yeah, that's a really good question, and we're trying to get a good handle on that. One of the key things is that the governor's plan calls for those high-risk individuals to stay home, that they should get special ability to work from home, but it doesn't require, where they can't work from home, any job retention. Employers are not required to keep their jobs. We're trying also to ensure that unemployment insurance, we know that for those in the high-risk groups, most likely are able to get that unemployment insurance. But if you are concerned and your employer is not making reasonable efforts to protect you, can you say no to coming back to work and still get those unemployment benefits? We're working with lawyers now to better understand that, but that should be the case, particularly if you have vulnerable people in your household.
What about employees who show up, they see a problem, and they're probably conflicted? On the one hand, they want the problem to be dealt with, but they're afraid of making waves. What happens in that situation?
Yeah. So retaliation is real. Our Immigrant Workers Center is receiving calls from people who have been fired just for testing positive for COVID-19. So despite it being explicitly illegal through the Occupational Safety and Health Administration's regulations, retaliation happens all the time. And in fact, OSHA is receiving many complaints for retaliation. They cannot address those. We need the state to step up and protect workers from retaliation so that they feel safe in reporting unsafe work conditions, or feel safe in stepping up and being part of ensuring that their employer is addressing the standards that have been set by the state and those that should be set by the state.
Aside from hotspots, what would you like to see for testing, especially since, as we've been told over and over again, a lot of people are spreading this virus who do not have any symptoms? So what needs to be done about that?
Yeah, I mean, I think that is a really important piece as to why a hazard assessment in every job site has to happen. You know, there are 3 ways that people can be exposed: through micro aerosol droplets, larger droplets, and surfaces. So we need to look and make sure that there's a plan in place to protect workers and customers from all these different ways. Masks play a role, but masks don't protect people from those tiny aerosol droplets. We need to look at options in ventilation and improved ventilation and other ways to ensure that workers are protected from those droplets. And really, it needs to be a process. Every work site, every employer needs to engage their employees in having a voice and doing that hazard assessment and creating a plan that everybody feels comfortable with moving forward. And that's not part of the plan right now. And frankly, there's a lot of small businesses that really would like to comply. They're on the floor with their employers and they want to be doing the right thing. They need compliance assistance, and there's no additional resources being put in to providing resources either to local boards of health so that they can provide that assistance, or to the state. But employers are going to need that support.
Masks and distancing are things you can see with the naked eye, but what about ventilation? I mean, how do you know the air is a problem?
Yeah, that's, we look at, and those are engineering controls where people need to look at what kind of ventilation is coming in and out. Sometimes it's as simple as making sure that windows and things like that. But I think that there's a lot of older buildings where the ventilation system is not what it should be. And, ensuring that in those spaces in particular, workers are protected with additional PPE.
Now, of course, the other thing that you're concerned about is the capacity of the state or some local government to follow up with inspections if
Yeah.
there's a problem reported or suspected. What about the capacity right now?
Yeah, we're trying to get a good handle on that, but we know that no additional resources were given to local boards of health, and yet they've been made responsible for this enforcement and definitely need additional capacity. We want to see that additional capacity so that they can do those inspections, so that they can take those complaints and respond to those complaints. Another thing that was really concerning is in the guidance that was sent out to local boards of health, it said that while they can continue to issue cease and desist for other health issues, they cannot issue a cease and desist to any employer who is for the sole purpose of not meeting the workplace standards that have been defined by the state. Instead, they need an injunction. And that is really troubling because prior to this, employers were able to, or local boards of health could issue a cease and desist on that. So, in some places we're worried that they, not only are they not providing resources, but they've actually weakened their ability to address the health and safety issues that may arise from going back to work.
Now, you've got people who might get sick for a while and they don't want to come to work because of their health, and they're worried about also having their job still there when they're ready to go back to it. Are there any protections for them at all?
Yeah, we're going to be talking a lot about this in our town hall on Thursday, May 28th, which is a workers' rights town hall. We'll be doing a series of these to help workers understand their rights for their very specific situation. If a worker has to either quarantine or is sick or needs to care for somebody with COVID-19, the FFCRA, expanded family paid medical leave, does provide some benefits. However, there's only a certain amount of benefits that they're provided. I am trying to get a hint, if you have to quarantine more than once, does that restart those hours? So we're really trying to make sure that we have answers to those questions for workers. And we work with many legal partners in ensuring that they can really understand when those benefits are available and when those benefits are not available. It's important to mention we also work with a lot of workers who don't have access to any of these federal benefits. And there are efforts on Beacon Hill right now to ensure that some of those workers, that we expand that to ensure that workers who otherwise can't access federal benefits will be able to get some of the stimulus money and other things like that.
Finally, Jodi, if workers out there have some questions or if they want to find out about any of the upcoming town halls, what's the best way for them to find those details?
Sure. We've got extensive information on our website, which is www.masscosh.org. In addition to information on those websites, we have a toolkit for all workers to be able to understand their rights, links to different fact sheets, information on the reopening plan, and information on OSHA, as well as industry-specific health and safety recommendations.